Good morning, everyone. Thank you so much for having me today. I've been to this conference twice now, and it's always just such a wonderful event, cool people doing cool things, and I always learn a lot. So I really appreciate the space, and it's really great to be here. So my name is Lauren Gant. I'm a senior evaluation specialist for the Evaluation Center housed within the University of Colorado, Denver. And specifically related to this, I serve as the lead evaluator for the Colorado SCOW program, which stands for State Epidemiological Outcomes Workgroup. And today I'm really excited because we'll be sharing out some findings from our recent publications that we have, specifically related to stimulants and opioids as well. One thing to clarify, Christine is on it and has so much 2024 data. We use a lot of publicly available data, so some of our data is 2023 and 2024. So if you see some discrepancies in our conversation, just wanted to flag that. But yeah, the publications that we have, right here. Yeah, so just a little bit of context about the Colorado SCW and who we are. So it's definitely not just me. It is a whole amazing network of data subject matter experts and state agencies that really come together who are passionate about this work to examine the patterns, context, and impacts of substance use in Colorado. We have an amazing steering committee filled with people who are not just in different departments, but in different sectors. We have public safety folks, we have folks working in treatment, prevention, all coming together to have these important conversations on what is going on in Colorado. We also do lots of community work. We'll do needs assessments with state and local health professionals. What data do you need? How are you using it? How can we bring it to you? And then so we all work together through in partnership and in community to create publications. And really the goal of these publications is to make them accessible, easily digestible. I know data can be intimidating for a lot of different groups, but everybody needs data. It moves the world, it creates policy, action, local initiatives. And so having data to make informed decisions is so, so crucial. So our role is we compile data from 40 different data sources. So many amazing, again, work with amazing data subject matter experts to compile this information to kind of put all of these different contexts in one space. So we have hospitalization data, we have youth data, we have adult prevalence data, we have overdose deaths data all in one space. So I'm sure you've used so many data publications that do really great deep dives on a specific topic. So having this high level overview of different topics in one space also serves its purpose. So we want to bring data to everybody to inform, like I said, local initiatives. That's talking about everywhere from legislators to folks who work with youth, superintendents, all of those different people. We want people talking about it and disseminating it today. So yeah, that's a little bit about us. Like I said, all of our information is completely publicly available. So if folks are interested in a specific topic, they can do a little bit of a deep dive and get more information. And then last thing is SCW is funded by a SAMHSA Blanc grant and then managed by the CDPHE. So that's a little bit about us. So diving into our specific publications that we've worked on for this project. So every other year, the Colorado State Epidemiological Outcomes Workgroup puts together these epidemiological profiles. And the topics of these profiles vary based off of the needs in our community. What are folks talking about? What data do folks need? So this past year, we did a needs assessment, and the topics we came up with were alcohol, stimulants, opioids, cannabis, tobacco, mental health, demographics. And we also partnered with a youth organization to compile an epidemiological profile that would be informed by youth, for youth, and folks who work with youth. What are they interested in? What are the data points that they want to bring to the forefront so that we elevate their voices? We care about equitability and accessibility. So those are our different profiles. And again, today, just for the purpose, I will be sharing out on opioids and stimulants. Just one thing also to talk about with these epi profiles is not only do we compile all these different data sources, but they show data at different levels. So we do Colorado versus national comparisons, Colorado and regional comparisons. So how do you fall compared to state averages? How do you fall versus other regions? And specifically when I talk about regions for our publications, we use health statistic regional regions, which if you're familiar with the opioid abatement regions, they're very, very similar. Just the health statistic regions were developed by CDPHE, and it's a way to bundle communities or counties based off of similar demographics. So it's a way that to kind of come over a suppression issue, because when you get into smaller counties, you don't always have that data. So bundling it based off similar counties with similar characteristics can be a way to alleviate that. So diving into some specific findings from our opioid profiles, kicking it off with youth data, what's going on with youth in terms of opioids. So for our youth data, we use the Healthy Kids Colorado data, which is the most comprehensive survey we have in Colorado that looks at youth and youth trends. So some interesting findings, again, in the actual epi profiles themselves, they have lots of context, quotes, ways to interpret the data, to make meaning of it, again, so it feels actionable instead of looking at data points on a screen like you would for a slide. So I invite folks to read the actual profiles. But some high-level trends, so there was a statistically significant decrease in the percentage of Colorado students, only looking at high school students, who misused prescription pain relievers in the past month. It was 6% in 2021, and that has changed to 3.5% in 2023. So some positive news there. And then again, as I mentioned, we do break down data by the different regions, so you can kind of see where there might be some ways that we could target specific areas and where there's higher prevalence. And then at the bottom, you can see I'm comparing different HSRs, where we're seeing it the lowest and the highest throughout the state. Other things that we talk about, so we also position the data within a public health framework, which is risk and protective factors. It makes it feel more actionable. It makes us feel like we have some tasks to do, I suppose. But for this one on the right here, we have, or on the left, is looking at protective factors for our youth. So the small little bar is that's the percentage of youth who misuse prescription pain medicine in Colorado in the past 30 days who had protective factors. And then that big blue bar is the difference of folks who did not have, who misused prescription pain relievers, who didn't have those key protective factors. So some of the protective factors that we have here are having an adult to go to for a serious problem, think families have clear rules, feel like they belong at school, and feel safe at school. So again, there's so much more on youth in the opioids profile. I would encourage folks to check out the full document, but those are just some high-level key trends going on with our youth. In terms of treatment, it's good to, we have a member of our steering committee who works at the BHA, specifically with the Drug and Alcohol Coordinated Data System. So when I'm talking about treatment facilities here, I'm really talking about facilities licensed by the Colorado Behavioral Health Administration. So in 2024, 23.8% of treatment admissions in Colorado were for opioids, and I have how DACODES classifies opioids here down at the bottom, and heroin in 2024. And this was an increase from what we saw in 2020. So in 2020, it was only 16.8%, and then again, it jumped up to that 23.8% of treatment admissions for those two substances in Colorado in 2024. And again, you can see the HSR maps. You can see where treatment admissions are higher, particularly in the southern part of the state. 27 years old is the average age of first use of opioids and heroin for individuals admitted into treatment. 9 years is the average number of years of use prior to seeking treatment for opioids. And then 12 years is the average number of years of use prior to current treatment for heroin. Diving into overdose deaths, I will lightly touch on this one since Christine did such an amazing, thorough job. But particularly, I guess what I'll highlight here is the top 3 Colorado counties in 2023 with the highest age-adjusted per 100,000 population rate of opioid overdose deaths, which includes total opioids, so any opioid analgesic, fentanyl, or heroin. The top counties were Costilla County, Rio Grande, and Saguache County. So again, hopefully it can be useful for targeting efforts. And then as Christine mentioned, it's not just important to look at overdose deaths, but also emergency department visits, particularly non-fatal emergency department visits. So when looking at age-adjusted rates per 100,000 people of non-fatal drug overdose emergency department visits for acute care hospitals involving synthetic opioids, includes fentanyl, from 2019 to 2023, we did see an increase since 2019. You can see that map over there, and you can see where it's most prevalent throughout the state. Again, that southern region as well. Diving into stimulants. Just looking at overall prevalence in Colorado, state averages compared to national levels to see how Colorado compares. So in 2023, 4% of Coloradans, and we're looking for all of these individuals 12 years or older, reported non-medical use of prescription stimulants, which is higher than the national average. In 2023, 2.5% of Coloradans reported using cocaine in the past year, which is higher than the national average. In 2023, 1% of Coloradans reported using methamphetamine in the past year, which is about the same as the national average. So that's just overall prevalent use. Diving in back into youth, 4% of Colorado's high school age students in 2023 have ever used stimulants not prescribed to them or differently than prescribed. And again, you can see where in Colorado we see more prevalent areas. 1.5% of high school age Colorado students have ever used cocaine, and 0.7% of Colorado students have ever used methamphetamine. And in the profile, we dig into how to talk to youth about these, where are some ways that they might be getting access to some of these substances. So again, good to dig into the actual profiles. Looking into overdose deaths with stimulants. Overdose deaths involving cocaine remain fairly stable in Colorado from 4.1 deaths per 100,000 people in 2022 to 4.7 deaths per 100,000 people in 2023. However, overdose deaths involving methamphetamine have increased in recent years in the United States and in Colorado. So they increased in Colorado from 11.7 deaths per 100,000 in 2022 to 13.45 deaths per 100,000 in 2023. And then the top 3 counties with the highest rate of methamphetamine overdose deaths per 100,000 in 2023 included Moffat, Montezuma, and Los Alamos County. And for cocaine, it was Denver, Adams, and Arapahoe are the top 3. Looking at treatment, 21.3% of treatment admissions in Colorado in 2024 were for methamphetamine and cocaine. In 2024, the number of treatment admissions for methamphetamine were 6.6 times higher than that of cocaine. 22 is the average age of first use of methamphetamine for individuals admitted to treatment. 16 is the average number of years of use prior to current treatment for methamphetamine. 21 is the average age of first use of cocaine for individuals admitted to treatment, and 17 is the average number of years of use prior to treatment for cocaine. So that was a lot of data I just threw at you, but it's really to just give you a little bit of taste, high-level themes that we're seeing in our EPI profiles, encourage you all to think about how you might use this and share it in your own work. Some uses that we have for the profiles could be, informing substance use needs assessments, inform grant writing and prevention efforts, and make data easy to share with many partners, raise awareness around one or more substance use related issues, and make informed decisions for strategies, programs, and outcomes. So again, our publications will be available on our website. We don't have a set deadline of when they'll be released, but we think later this fall they will be released. So check out our website, sign up for our newsletter. We'll be sending out an email blast of when those are available. And if you have any questions, please reach out to me for anything you need. And that's it. Thank you.
Do we have any questions online that we can take just a minute to answer?
None that I've seen come through yet, but if anyone wants to put one in, we will try to get that to Lauren or the team and get an answer for you.
Thanks, Sarah. Looks like we got one in the back.
Back here.
Oops, sorry.
Miss Tanya. Thank you, ladies, for great presentations. That's very exciting to be able to watch those numbers. My question is about alcohol and the fact that none of these numbers represent alcohol in the devastation across the state of Colorado. Do you guys have numbers around alcohol misuse and deaths related to alcohol use? And if so, how can we see those?
Yeah, I'm happy to go first. Great question, and I agree with you. It's such an important topic. I'm grateful that you lifted that up. Yes, we have a whole profile dedicated to alcohol, and you're absolutely right. Looking at the numbers, it should be top of mind and top of conversations, especially when thinking about youth. It still remains the most used substance when looking at youth, and then yeah. Yeah, lots of things to say there, but yes, I would encourage to check out our alcohol profile. Thank you for saying that.
And I will share with folks, and I know we're going to take a break here in a minute, but on the alcohol piece, there is a new statewide coalition that's being formed around alcohol, partnership with the School of Public Health, with the Stedman Group. I've been part of that group as well. But if anyone has an interest in pursuing the issues around alcohol, we're looking at setting up a whole new state consortium or coalition to address that at the local level and at the legislative level as well. Okay.
And we do have one online. Jess, do you want to take it?
Given the heightened overdose risk during re-entry, I'm curious whether SEOW work current surveillance systems capture data on opioid and stimulant use among youth, young adults in correctional or detention settings.
What a great question. We don't currently track that, but I'd be very interested in looking more into that. That's a great suggestion. So thank you for lifting that up. That's great.
Add one more question back here. Middle. I'm not seeing you. Where's your, oh, back here. And this will be our last question before we do a break.
Sorry, this is actually not a question. I wanted to follow up once more on the alcohol piece that, yes, the SCOW does have an alcohol profile, and also Colorado was very lucky that we have a full-time alcohol epidemiologist at the state health department. And if you want her contact information, I'm happy to share that with anyone. She's got a lot of great data that are publicly available.
Thanks so much, Mara. Thank you all so much for joining us this morning for the first part of our 13th annual meeting. For those of you who I have not met, my name is Jennifer Place. I'm the Assistant Director at the Consortium, and I would love to invite you all to a 10-ish minute break. We will resume up here with our next panel right at 10:30. So thank you.